afternoon, everyone. I'm Maya Gray. I'm the Vice President of Customer Integration and Activation at Surescripts, and thank you for joining us for this panel on connecting the unconnected. We're specifically focused on underserved markets in the long-term post-acute care space. I'm going to ask my panel participants to introduce themselves and tell us about their organization and when they started with Direct and why.
You're on your own.
Good afternoon. My name is Mary Palin. I work for the Mental Health Center of Denver. We are a behavioral health center that serves close to 9,000 consumers. We do over 75,000 visits a year. We serve 0 to aging, so we serve children, adults, and families. And I am medical records director, also HIPAA compliance officer and regulatory compliance. So I had a direct interest in direct messaging for security and safety of our records and documents. And when I heard about direct messaging, it was about 8 months ago. So we've just become first adopters, and I'm going to talk about my experience and some of the challenges that we've had with direct messaging.
Thank you, Mary. Sterling.
Hi, I'm Sterling Short. I'm with Sante Partners, and we're a post-acute provider. We have facilities licensed as skilled nursing that we operate as short-term rehab facilities. We also have home health and hospice, and we've created essentially a post-acute, integrated post-acute system. We're also doing Model 3 bundling, and really it's because of Model 3 bundling that we're now much more interested in interoperability and creating a system around that to coordinate care. And we started direct messaging with No2 about 8 months ago as well.
And Teresa?
I'm Teresa Bell. I sit as president and CTO of Inofile. We provide the technology that makes it possible for our customers to connect with the connected providers.
Great. So neither of your organizations were actually directly impacted by meaningful use, but you chose to go with direct messaging. So what trading partners were the catalyst for your interest in direct messaging? Who are you trading with now? Mary, if you want to.
Well, our behavioral health center does have direct meaningful use.
Okay.
So we are transitioning to electronic health record. We have one. We're going to a new one. With going into meaningful use stage 2, I was very concerned about the data transition of and digital transition of information. So I started looking at direct messaging. I had worked with Trace Bell as a consultant for our medical record for some scanning documents. So I started to talk to her more about direct messaging, which was really of interest to me because of safety and security, and particularly with meaningful use and having to be able to send data electronically and digitally. So what I found out about direct messaging is kind of like beyond with meaningful use with our electronic record. We can actually receive, we can send and receive documents through direct messaging, which is really a cost-effective and security-effective, and is really going to save us a lot of time and workflow in the future. So kind of like how direct messaging would work for our medical record is that we get several requests like every month, probably between 150 to 200 requests for information. And so we're constantly sending out documents. It takes us 20 minutes to 2 hours or more to send out records from the electronic medical record. We would need to put the electronic records together, copy them, and then we would pull out our scanning documents, and sometimes we'd have to pull out paper documents from our record. With direct messaging capability, we can put all those documents into one file. We can pull electronic records from the EMR, we can pull the scanned documents, and we can scan paper documents into the direct messaging software so that, so we can then bundle those records together and then send them through direct messaging securely. What the other benefit is as those records are sent, on the receiving end, the person, it's kind of like, it's sort of like an email. They would be I could tell that they had received the message, and I can tell when they've opened the message. And then for my medical records department, if there's an entity who says I didn't receive a message, in the past what we would do is we would have to like put the documents back together again and send them to them, kind of recreate what we had just sent, or make copies of everything that we were sending and then resend them. So through direct messaging, we already have a tracking trail, and we have all of our paper real time, what we've actually sent. The other benefit is that we'll be able to receive documents from other entities, so other behavioral health organizations, hospitals, possibly like audits and things that we're doing with our state of Colorado. So when we receive documents, we can receive those securely through direct messaging as well. My medical records staff loves it, that they can absolutely just upload documents from that electronic messaging system right into our EMR. So I know I need to talk a little bit about, I guess I can talk about that later, about kind of like some of the challenges and benefits.
I think it'd be important, just because we know her so well, what Maya's really interested in, I think it'd be important for the crowd, is to know the groups that you've traded with and how you've looked at exchange. You started somewhere, but your lessons learned have brought you somewhere else.
Okay. So originally I thought this would be really a great tool to use with our hospitals. We do some integrated care and behavioral health, and they send us records, and we need to exchange information back and forth with our hospital partner. They are faxing information to us, and I'm as HIPAA compliance officer, I'm very concerned about faxing, and it's not secure. So I was hoping to get the hospital on board with this, but that didn't work. They were just kind of like very large hospital, and talking with their IT department was a little bit challenging. So I decided that my strategy would be to go for more smaller wins. We exchange a lot of information with attorneys, with the courts, and some with our behavioral health partners. So I worked with one of our behavioral health partners in northern Colorado. We were doing some telebehavioral deaf counseling through telebehavioral services and charting in our record, and we needed to send them our notes. So I got them eventually signed up with direct messaging, and realized it took a little bit of time to get them on board with the direct messaging, because I was not really talking to the right people. I was talking to the clinical director and not the medical records staff, who were the ones that really needed to receive the records and get them into the EMR. So that was kind of like a big lesson learned about direct messaging, is like who to talk to. And so a lot of what my strategy and plan is to start working with the entities that we do send information to and that we need to get the information back from, and start talking with the departments, the medical records departments, and then some of the other players that would really be interested, particularly in the cost effectiveness of sending the documents. And I think the other big point I want to make too is we do a lot of exchange with attorneys, and our attorneys are helping our consumers who do Social Security disability. They may have been denied their disability benefits. So the attorneys are really doing a lot of that work pro bono. So for them, getting documents timely and quickly and through like electronic security is like, that's really been probably my biggest win, is with those attorneys, because oftentimes they may not get the paper records, and then I'll have to get them together and resend them to them. So I think that, going for the smaller wins with some of the partners we send information to and receive information from the most is really going to put us into position for meaningful use and helping explain the data transfer of information.
So I heard you say you exchange with legal entities, your state entities, other mental health organizations, as well as health systems?
Yes.
Is it similar for you, Sterling, for your organization?
Right now, using No2 came about from a very large hospital system in Phoenix, Banner, and they really reached out to us as a part of meaningful use. So we're not inside of meaningful use, we're outside of it. But they reached out to us our skilled facilities, again, we do a very high rehab business. So we have about probably 20 to 22% of the fee-for-service market in Phoenix. So we were we have that volume of patients, we were an obvious target for them to reach out and create this technology. So when they reached out to us, we jumped into action and established the connectivity and data exchange, direct messaging with Banner.
Thank you. And Teresa, we've heard No2 referenced several times, so if you could give us more information about No2 and NFL and how you're providing this service.
Yeah, with No2, we looked at that unconnected market, those maybe not incented by meaningful use and didn't see the benefits of meaningful use. And how could we provide a product that would allow them to stay in stride with the hospitals in the ambulatory space and stay connected to them, but become affordable, really be designed for their workflows and designed for their needs. So we reached out to some groups early on when direct messaging was really just starting to take adoption within the acute care space. And these two groups, both in the behavioral health space and the LTPAC space, were great candidates for us. So No2 provided them a way to really get control of their own direct messaging environment and their own interoperability environment and start connecting to all the partners around them versus being subjected to maybe what the hospitals were dictating to them in their surrounding communities.
And is No2 used within your EHR now, Mary? And
Yes.
Or it's directly integrated? Okay.
Yes, it is.
And you mentioned workflows. So what workflows did you have to establish to support direct messaging in your organization? Were there new workflows? I know you said it replaced fax and kind of having to pull from several different areas. Did you have to train, and what workflows were established?
Actually, the training wasn't too difficult. I think the main thing was we had to get our IT department involved to get our PDF files set up for our record, and then to integrate to our scanned records. But not really. I mean, it was like a really easy workflow. As soon as my staff saw what they could do and putting things together and then sorting it by date or by different type of provider, and they could change the information around the PDF file and send it. It was really very, very simple to use.
Right. So we have we've centralized our admission process within our organization. So we have a team. We call it the CAP, Central Admission Process, so that's where we're bringing in the No2, the direct messaging. And it's just a much easier way of communicating, transacting that data.
And Teresa, what other types of organizations are utilizing No2 for direct messaging now?
Well, we reach into any parts of the unconnected space, and that can in some cases include the ambulatory space if they're still unconnected or they've chosen not to adopt an EMR, or maybe an EMR that's not certified yet. But workflows, we knew with the technology it had to be able to be associated with any workflows and adapt to any workflows easily, and do that cost effectively without much change to the organization, if any. So that's where the impact, as you've seen with Mary, is very minimal into their current environment, and same with Sante. I think what was unique about Sante's environment, different from Mary's, is that they had many hospitals asking them to take documentation through, and they had to be able to absorb that through a single process, which No2 allowed them to do.
Do we have any questions from the audience? I do want to give you all an opportunity to ask any questions. Can I get an idea of what type of healthcare providers are in the audience now? So do we have any acute care organizations? Ambulatory? Okay. Post-acute? And for our post-acute care organizations, are you all utilizing direct messaging as well to talk to other folks in the healthcare community? Yes, no? And ambulatory? Are you utilizing direct messaging?
I didn't get the beginning of what you were talking about. We have an EMR with prescriptions.
But not direct messaging. E-prescribing, but not direct messaging. Okay, that's helpful. Mary made a good point earlier about reaching out to the folks that they wanted to connect to in their healthcare community and not getting to the right person to have the conversation regarding direct messaging. What key learnings do you have from that? So you said you reached out to the wrong department earlier. So do you consistently reach out to the same folks now?
Well, I actually No2's been very helpful with this as our vendor. One thing I decided to do is to get a little bit more aggressive about, or assertive about, saying I don't want to use fax anymore, it's not secure. So, and really kind of explaining that to some of our partners, particularly other behavioral health centers. I feel like getting other managers and directors on board with me to make sure that we are sending information secure, and this also they're going towards meaningful use. So I feel like that is going to be really a big win. I think the other piece is like in reaching out, kind of really personalizing my message to them when I'm sending out an email, and then letting them also know that there is support available through No2. And with our attorneys, they weren't like really technically savvy, and they kind of admitted that, but they really stuck with us. And I think it was, the fact that they knew that they were going to get a big benefit from this, and then that the support at No2 was really so helpful. And then recently I hired a new manager, so I'm really able to turn the project over to him, and he's really more technically savvy than me. So he is very excited about going out and working with more of the entities. I just really want to take this to the next level. Besides just our attorneys and our behavioral health partners, we do get a lot of UA labs, like for substance abuse. We get those through emails, which just makes me cringe. And I really want to help. I want to get my manager to help me with getting some of the emails also that we get insecure from the labs. So that's kind of my next strategy. And I guess I think that was probably...
Yeah, I was just going to adjunct to what Barry was saying. Some other areas that we're looking at within Colorado is obviously the active health HIE there with CoRio. They've shown interest in bringing and extending the use of direct messaging for feeding content into the HIE, structured content that normally they wouldn't have had exposure to, is using No2 as a way to deliver important but very critical information from Mary's group. Obviously, it's going to be very controlled because it's behavioral health, but being able to feed the HIE.
So just to kind of talk about that a little bit more, the health information exchange, of course, that's really a big part of the meaningful use. And so with us, behavioral health, there's so much sensitive information and substance abuse information that we participate in the HIE, but we have a behavioral health subcommittee, and we're looking at alternatives about how we can really exchange the information. So thank you for bringing up that point.
Sterling, for Sante, it sounds like you're mostly utilizing direct messaging for inbound transitions of care, or at least referrals. Have you had to do outreach to any of your healthcare community and get them connected, or ask them to be connected for direct messaging?
I think we're right now in process to do that. But really what we're really looking at right now is we are a Model 3 bundle payment participant, and we're about to go to the risk phase of that starting July 1. So bundle payments, it's a CMS initiative, ACOs, bundle payments, it's all part of the new payment program. So we're going to be be a pilot participant in bundle payments. So with that, it really, how bundle payments, it's a single payment for all care associated with a treatment or a condition. So with bundled payments, we will be taking on risk. We will be given a payment. In simplest terms, we will have a payment from CMS, but now we will be taking on a 90-day episode risk of most Part A and B claims. So now we're designing a care coordination overlay within our company. Before, we just had each of the individual silos operating, granted within an integrated system, but now there's a real need to coordinate care. And so with that, we have a real need now for interoperability of data. And so this is where we're just right now in the process of into really figuring out how this all is going to work. And it's a very challenging from just a technology standpoint and operations standpoint. But this is where, so we have the challenge is not just bringing the data in from our hospital partners, but we have different software solutions that each of our service lines uses, and so that the challenge is even within internally how to exchange that data, and then externally passing that data on to primary care physicians and other partners. But this is all we're hoping to be able to achieve interoperability. I'm hoping that there's, the seas are going to part, and we'll get a good exchange of data with our hospital partners. But then within our own system, again, our own suite of software solutions that we use, again, just being able to exchange that data is a bit challenging. So we're hoping to use to do that.
So for internal messaging as well as external.
Internal
secure
and
messaging.
external, absolutely.
That's perfect. That's perfect. Again, I want to give the audience an opportunity to ask questions. And I'd like you all to share what you feel like your biggest barrier has been in adopting direct messaging beyond getting to the right people and communicating with the right folks. And what would you see as like the best case of how you would continue to utilize direct messaging going forward? Like in a perfect world, this is what it would look like for you. Sterling, we're going to let you start because Mary's been on the hot seat.
The biggest barriers, I think it's just awareness. I think everything, change happens slowly, and I think I'm not really on the front lines of the operations to know how this is working, but I suspect that once folks realize the technology and how that results in change, they welcome that change. But until they really see it, they don't know. That's what I would suspect is true.
Absolutely. And Mary?
And I would have to agree with that. I think the awareness of direct messaging that even exists is really not known. And although there are these stages of meaningful use that we're going to be going through, I mean, that's the hardest part. I'm like, nobody understands what direct messaging is. So I think that building that awareness is really where our challenge is. I think in the best case scenario is that, we would really be getting, like a lot of our other behavioral health partners, up and running with this. And then I think, this point that Sterling made is like, getting the involvement with the hospitals as well. And really understanding, that we're like one of those outliers. We're not like in the main flux of like information flow like through a hospital, like behavioral health and physician offices. All of those smaller entities on the continuum of care really can benefit from the direct messaging.
And Teresa, do you see a strong movement in the underserved markets towards direct messaging?
We're starting to. I think those that are one step removed from being impacted by meaningful use, especially in that post-acute space. The behavioral health side, we actually, in terms of adoption, we have our widest adoption in behavioral health. And I think it's the sensitivity of the records that's driving that, but it's that awareness and their ability to do an outreach from where they're sitting and be able to connect to anybody, which is a factor of time. But yeah, absolutely, we're seeing an uptick now for sure.
Any questions from the audience? All right, I would like to thank our panel, Mary, Sterling, and Teresa, for joining us today, and thank you all for joining us as well.
Thank you.
Thanks. Thank you.